Communication is the foundation of good sex. Research consistently shows that couples who talk openly about their sexual needs, preferences, and boundaries report significantly higher levels of sexual satisfaction. This isn't touchy-feely advice. This is data. Studies published in journals of sex and marital therapy, in archives of sexual behavior, and elsewhere have demonstrated this over and over. Talking about sex before, during, and after leads to better sex, period. Number 2, female sexual response is diverse and complex. The old Masters and Johnson linear model of sexual response, the excitement, the plateau, the orgasm, resolution, has been significantly expanded. Dr. Rosemary Basson proposed a circular model of female sexual response that acknowledges that many women don't start from a place of spontaneous desire. Instead, they may begin from a place of sexual neutrality and move into arousal and desire through physical and emotional stimulation. This means that a woman who doesn't feel spontaneous desire is not frigid or broken. She may have what's called responsive desire, and it's completely normal. Number 3, the clitoris matters. I said it before, I'll say it again. Most women need clitoral stimulation to orgasm. This should be taught in every sex education class, discussed in every relevant clinical encounter, and known by every sexual active human being. The fact that it's 2026 and this still surprises people tells you something about how deeply entrenched this misinformation from books like this 1953 guide really was. Number 4, mental health and sexual health are deeply interconnected. Anxiety, depression, trauma history, body image issues, relationship conflicts, all of these can profoundly affect sexual function and satisfaction. Modern approaches to sexual health always consider the psychological and relational context. A woman who isn't enjoying sex isn't frigid. She might be stressed. She might be depressed. She might be on a medication that affects her libido. She might be in a relationship where she doesn't feel safe or respected. And she might have unresolved trauma. Or she might simply never have been given accurate information about her own body. The diagnosis isn't frigid. The diagnosis is, let's figure out what's actually going on and address it holistically. Number 5, consent is ongoing and essential. I touched on this earlier, but it bears repeating. Modern sexual ethics and modern medicine are aligned on this. Enthusiastic, informed, ongoing consent is the baseline for any sexual encounter, not the ceiling, not the floor. This is true in new relationships, in long-term partnerships, and in marriages. The 1953 text never once used the word consent. Not once. And that absence speaks volumes. Number 6, orgasm is not the only measure of sexual satisfaction. We've talked about this, but let me put a finer point on it. Research shows that many women report high levels of sexual satisfaction, even in encounters when they don't orgasm. What predicts satisfaction? Feeling emotionally connected, feeling desired, feeling respected, experiencing physical pleasure, which doesn't have to be or end in orgasm to be pleasurable, having fun, feeling safe. When we broaden our definition of good sex beyond orgasm, we liberate everyone, men and women, from the performance treadmill.